In this segment of the presentation, we will look at some of the important information you need to know before you take the first dose of your new medication. As with all medicines, there are some patients who should not take it, some special precautions in elderly patients, and of course, there are a number of questions that you may have about how and when to take it, along with questions about how it might affect you. As with any prescription, your doctor will have taken many factors into account before prescribing this medicine for you. To help you answer some of the common questions, we are joined by Aidan Murphy, a qualified pharmacist and a member of the Pharmaceutical Society of Ireland. Aidan, are there patients who should not take this medicine?
There are some patients who should not take this drug. Your doctor will be aware of your medical history and will know whether this medication is suitable for you. However, there are some specific patients who cannot take this medicine. These include if you are allergic or hypersensitive to febuxostat or to any of the other ingredients of Adenuric, you should not take this medicine. The other ingredients are discussed later in the presentation. You should take special care taking this drug if any of the following apply to you. If you have or have had heart failure or heart problems, if you are being treated for high uric acid levels as a result of cancer disease or Lesch-Nyhan syndrome, a rare inherited condition in which there is too much uric acid in the blood. If you have thyroid problems. Also, if you are having an acute attack of gout, you should wait for it to subside before taking your first tablet, as in theory they could initially make the attack worse. For some people, gout attacks may flare up when starting certain medicines that control uric acid levels. Not everyone gets flares, but you could get a flare-up even if you are taking this medicine, and especially during the first weeks or months of treatment. It is important to keep taking this medicine even if you have a flare, as Adenuric is still working to lower uric acid. Over time, gout flares will occur less often and be less painful if you keep taking this medicine every day. Your doctor will often prescribe other medicines if they are needed to help prevent or treat the symptoms of flares, such as pain and swelling in a joint. Your doctor may ask you to have blood tests to check that your liver is working normally. Again, your doctor will be aware of your medical history, and it is very important to help your doctor get a full picture of your health by answering all of their questions. Your doctor will have taken your history into consideration before prescribing this medication. But if you are still unsure about any of the reasons not to take this medication, do talk with your doctor and follow their advice. If you have to have surgery, always inform your anaesthetist that you are on Adenuric before being anaesthetised.
Aidan, what about pregnant women or women who may become pregnant?
You must tell your doctor if you think you are or might become pregnant. The effects of Adenuric on pregnancy have not been studied, and so you should not take Adenuric. If you're pregnant, your doctor will recommend an alternative medication. You should also tell your doctor if you are breastfeeding or about to start breastfeeding. Adenuric is not recommended for mothers who are breastfeeding, and your doctor may choose another treatment for you if you wish to breastfeed.
And how do you take this medication?
Always take this medicine exactly as your doctor has told you. You should check with your doctor or pharmacist if you are not sure. The tablets should be taken with water. They can be taken with or without food, but like every medication, you should try and take them at the same time every day.
What is the dosage?
You should always follow your doctor's advice in relation to the dosage of this drug. Adenuric is available in two strengths, 80 mg and 120 mg, and your doctor will decide which one is most suitable for you. The usual dose is 1 tablet once a day.
Is there any difference with elderly patients?
No, there's no difference in treatment between elderly patients and other adults.
What happens if you take more than you should?
If you accidentally take too many tablets, contact your doctor or nearest accident and emergency department immediately, taking any remaining tablets, the carton or the leaflet with you if possible.
If you forget to take it?
If you forget a dose of this medicine, but remember a little later on that you should have taken it, take that day's dose as usual. However, if a long delay has occurred, maybe several hours, so that the next due dose is near, skip the forgotten dose and take the next scheduled normal dose at the usual time. Do not take a double dose. Repeated skipping, however, should be avoided.
What about using it in children?
This medicine is not recommended in patients less than 18 years old.
Aileen, with this medication, will I still be able to drive or use machines?
As with many medications, Adenuric may slightly affect your ability to drive and handle machines due to the possibility of dizziness or drowsiness or a tingling sensation. If you notice any side effects like this, you should wait until the effect has worn off before you drive again or operate a machine.
And what happens if I stop taking it?
You should always tell your doctor if you plan on stopping this medication. Even if you begin to feel better, stopping your medication without medical advice could lead to a build-up of uric acid crystals and a worsening of symptoms. You should follow their advice about your treatment and discuss any changes with your doctor.